Great. Good morning. Thank you so much for having me here today. I know a lot of you are probably a little confused about how is thermography going to be involved with anti-aging medicine. Well, I'm here today to tell you that 30 years ago, thermography kind of disappeared because the American College of Radiology was very organized in their ability to get mammography on board. And any of you who've been practicing medicine for about 30 years, you know that we started out with xerography, and then we moved on. Radiologists are really involved in technology and technological advancement. And I'm just so proud to be here today because I think today is a new day that we are going to be able to marriage alternative medicine with the anti-aging medicine and the technology that we have. And I'm going to talk a little bit about how I created this in my practice. Every one of us has a story, and my story is where I really got passionate about women's health is that I lost my mother in 2003 to breast cancer. And my mother was a role model to me because she talked about organic foods. We worked out together, and I didn't understand how this woman could die from this devastating disease, especially her strong will to live and her spiritual component to her. But I know now because when my mother died in November of 2003, I opened up, it was a new birth with Rose Clinic, and that was in January of 2004. This next slide is very powerful because you see the image of a woman with a child, and then on the right-hand side you see a normal breast thermogram. Now here she is holding her child, and she has no idea that physiologically a tumor is growing in her breast. Now, with the advancement of thermography related to inflammation, vascular patterns, and heat differential, we're able to pick up the highest risk indicator for breast cancer years before we can see that on a mammogram, ultrasound, or MRI. So I want you to think about this because it's very powerful. The other question I'm going to ask you is, can you image 3 cancer cells? Think about that. Because I have to get you in the mindset of functional medicine and physiology. Infrared thermography is a highly developed technology. 90% of the universe was mapped out 30 years ago with infrared imaging. The military used it, and then we had medical devices for infrared imaging and just found inflammation and diseases years before we would see it on imaging. It meets the sensitivity and the speed requirements. It's digitally used, and the applications contain the majority of screening and diagnostic information that you can use in your practice with all the tools that you acquire in this conference and during the fellowship and other functional medicine programs. And I'll teach you a little bit about that as we move on. Here's a schematic of, you see visible light. The visible light is your gamma, X-rays, and UV light. The invisible light is infrared, microwaves, and radio waves. So right now, you can't see the infrared heat that I emit from my body because it's invisible light. But this is where this very sensitive, specialized camera gives us this information. The human body is capable of maintaining a relatively constant internal homeostasis. We fight for this every day. I tell my patients in my practice, your body fights every day to heal you. You don't just wake up one day with hot flashes, fibrocystic changes in the breast, mood swings, insomnia, fatigue. Your body has been trying to maintain that homeostatic state, but then it can't do it anymore. And this is where you'll see infrared imaging assist you. Here's some articles. There's a lot of controversy about thermography, and they'll say, well, there wasn't enough research done on it. There's not enough peer-reviewed literature. There's over 800 peer-reviewed literature on this subject. Back in 1976, we see Gautry and Gross. Thermal imaging was established by the consensus. It's the highest, and I want you to remember this, the highest risk marker for the possibility of presence of an undetected breast cancer. The one tool, the highest risk indicator, with the other tools that you have in your basket as well, and I'll show you that as we go on. From a patient base of 58,000 women screened with thermography, Gross and his associates found that 1,527 patients with initially healthy breasts, following them over time, abnormal thermograms for 12 years. 44% developed malignancy within the 5 years. So it's pretty significant for us. Unfortunately, it was put in the back room. Amroek and Spitale reported on 25,000 patients screened and 1,878 histologically proven breast cancers investigated with infrared imaging. The study noted, now this is the other thing that's key, when you have very hot vascular areas in the breast, the prognosis was found to be poor, versus a biologically inactive cancer. And there's a lot of controversy in my field about DCIS. You have doctors over here that talk about DCIS as precancerous, and then you have doctors over here that said, I saved your life and I did a lumpectomy and you no longer have cancer. When it's cold on a thermogram, it is not biologically active. The immune system is doing its job, the detoxification system, and the endocrine system. They're all a symphony together, and they're absolutely doing their job.